It was really bad because sometimes I would get coughing attacks and I'd have to get up and walk out of meetings because I couldn't stop coughing.
Peggy Myszkowski has had a terrible sinus infection for the past 6 months.
I've gone to several doctors trying to get this cured, and they keep giving me antibiotics and doing other tests, and nothing has helped get rid of the infection.
Peggy finally went to see Dr. Howard Yerman, the chairman of the Department of Otolaryngology at the DMC's Huron Valley-Sinai Hospital. Dr. Yerman suggested surgery.
What he's saying is that the area where all your sinuses drain is very inflamed, and so nothing can drain, and that's why the antibiotics aren't working, is because even though I'm taking the drugs, the stuff that's in there can't get out.
The objective of the sinus surgery is to increase the diameter of the passages so the mucus can drain more effectively. Most of them drain through the area of the ethmoid sinus. The ethmoid sinus is like a long, narrow building with a number of interior walls. And the goal of sinus surgery is to go in and remove the interior walls, but leave the exterior walls intact, improving what used to be a convoluted passageway for the mucus to drain and making it a straight shot.
With Peggy under general anesthetic, Dr. Yerman first used an endoscope with a tiny camera on the end to check out her nasal passages on a monitor.
That's a little bit of infected mucus at the back of the nose. And that's the reason we're doing things. We're going to try and open things up so they drain.
Then, to actually perform this delicate and complex surgery, the doctor employs a revolutionary image-guided system that gives him precise and highly detailed 3D images. The images help to guide his instrument with a tiny blade on the end through the twisting nasal passages deep into the blocked sinus cavities. Then, he uses the instrument to trim and suction away both tissue and bone with great precision.
The beauty of image-guided surgery is that we don't enter into the bone that surrounds the eye. We don't enter into the bone that separates us from the brain. It's a way to allow us, hopefully, to do the procedure more safely and more completely.
The patient is being awakened now. She'll be released later today, maybe with a little discomfort because of the nose packing, but she should be 80–85% recovered within 2 or 3 days, completely recovered within about 6 weeks. To learn what Peggy can expect, we spoke to Kimie Kitahara, who recently underwent the same procedure.
But before this, I would talk like this. I mean, it was awful. Couldn't breathe. You know, I'd sleep at night and I couldn't breathe.
Kimie's surgery went well, and she went back to work a week later. Kimie says she experienced no pain at all.
I'm a different person now. I can breathe, smell, and taste. So, and life's completely different. You know, if you can breathe and smell and taste.
While this latest advance in image-guided surgery is a boon to both surgeon and patient, Dr. Yerman offered this caution.
I think you want to select a doctor who can thoughtfully look at a patient, try and make a decision that a procedure will or will not help, because just because you have image guidance doesn't mean you're necessarily a good surgeon.
Dr. Yerman just makes me feel comfortable, even to this day. I think he's like the best. And the whole Huron Valley is like one of the best hospitals that I've been to.
Visit us here at DMC.org to learn more about sinus surgery with advanced image-guided technology, or to make an appointment with Dr. Howard Yerman and his fine team at Huron Valley-Sinai Hospital. The DMC. We just think it's a better way to get better. I'm Emery.